My name is Dr. Fumiko Chino, and I am a treating radiation oncologist at Memorial Sloan Kettering Cancer Center in New York City. I specialize in the treatment of breast and gynecological cancers. Today I want to talk to you about what radiation oncology patients should know about taking care of their pets during and after cancer treatment. I'm delighted to help patients with cancer who share their home with a cat or a dog because my own cat Franklin means the world to me. I always ask my patients about their animals. I ask who's in the home, including pets. It's part of knowing who my patients are, who is available for support in the home, and helping keeping everyone safe. The most common questions I hear from patients with pets are, can I hurt my pet as a result of my radiation treatment? And can my pet hurt me while undergoing treatment? I'll address each of these questions in turn. First, your radiation treatment in general can't hurt your pet, but there are exceptions. You need to be concerned if you're having brachytherapy, which is a permanent radioactive implant, most commonly a seed implant for prostate cancer. You are temporarily radioactive. So for example, you should not have an animal sitting in your lap. The amount of time you need to take precaution varies based on the type of implant that you receive. If you are being treated with radioactive iodine, which is typically used to treat thyroid cancer, you may be advised to not sleep with your pets for several days to weeks. As a result of this treatment, you should also take care to wash your hands a bit more frequently if you are in close contact with your pets. If you're having a PET or a PET scan, there may also be restrictions that you should discuss with the radiology team, like avoiding close interactions with young animals less than 2 years old for several hours following the scan. Outside of these specific scenarios, you generally don't need to be concerned about harming your pet from your radiation treatment. Your pet generally can't hurt you, but let's talk about a few instances you should keep in mind. I would advise that you keep your pet's nails trimmed to decrease the risk of scratches. You're usually safe to sleep in bed with your pet, but it depends on where you are in your treatment and how at risk for a severe infection you are. I've had some patients who have gotten infections and cellulitis from scrapes from their animals. You're more likely to get a scrape from your animal if it's the type that moves its paws in its sleep, or if you're a person who is restless in bed and might roll over onto your pet. If you end up with a scratch or a bite and you're on active treatment, you should get evaluated at your cancer center. However, if your pet bites or scratches you and that results in a severe wound, you should be evaluated immediately in an emergency room. In general, emptying your cat's litter box can't hurt you unless you're on total body irradiation. That is the one treatment that does significantly compromise your immune function. It is typically given as an inpatient, so hopefully you won't have litter box duty during it. Many patients undergoing radiation worry that there may be times where they don't feel well enough to take care of their pet. Fortunately, many patients receiving radiation are able to keep up their daily activities without restrictions. The thing I try to emphasize is that, except in rare situations, you are not radioactive, you are not going to emit radiation, and you're not going to hurt anyone in your household or your animal. In fact, you're not immunocompromised for the most part. You can go about your normal activities. We have good evidence that if you're able to maintain your activities, like walking a dog, it's actually very helpful for you. If you continue your day-to-day life and stay physically active, it will improve your mood and energy during treatment, and it increases your long-term health outlook, especially in terms of cardiovascular and pulmonary health. I would always encourage you to speak to your provider team, including your veterinarian, about any concerns you have regarding you or your pet's health.